Endocrinology is a branch of medicine that deals with the endocrine system, which controls the hormones in your body. Hormones are essential for our everyday survival. They control our temperature, sleep, mood, stress, growth, and more. I'm Kaylee Knox, Advanced Practice Registered Nurse with the Salina Regional Endocrinology Clinic.
Well, Kaylee, welcome to the show and welcome to Salina Regional Endocrinology. But you're not new to the Salina Regional family. Why don't you tell us about your career up to this point?
Yeah, so thank you so much, and thank you for having me on the show today. I actually started at Salina Regional back in 2015 as a tech or a nurse's aide, and then I went back in 2016 as a registered nurse. And then kind of in the middle of all that, I did a stint of travel nursing for about a year and a half before I came back to Salina Regional full-time as I finished out my master's degree.
Well, let's talk about the endocrine system, kind of what that all entails.
Yeah, so the endocrine system is comprised of several different organs and glands. So it includes the pituitary gland, the pineal gland, the adrenal glands, and then the hypothalamus, the thymus, thyroid, and parathyroid, the pancreas, and the reproductive organs. So typically what we tend to see the most of in the endocrinology clinic is things like type 1 and type 2 diabetes, hypo and hyperthyroidism, Cushing syndrome, Addison's disease, acromegaly, osteoporosis, and low testosterone.
Well, let's talk about some of your areas of interest within the endocrine system.
I was diagnosed with type 1 diabetes when I was 7 years old, so I've always had a special interest in diabetes and the endocrine system in general. That's really why I went to nursing school in the first place, and it's why I decided to go back to get my master's degree, and ultimately why I really wanted to work in endocrinology. I know how valuable it can be to have a provider who really kind of understands what you're dealing with.
Let's look in a little bit more detail some of the things you do with the diabetic patients.
Sure. So over at the endocrinology clinic, it's not just me obviously that works there. I work with Dr. Go Mendoza, and then Leslie Mack, she's another nurse practitioner, and then Lindsay Elder, she's a diabetic educator. So all of us work with the patients to come up with diet and exercise and a medication regimen that's going to work the best for the patient. So whether that's oral medicine, injections, or something like an insulin pump, we can all kind of work together to get the patient set up with all of that.
Well, Kaylee, thank you so much for coming on the show, and thank you for watching. For more information, you may visit salinaregionalendocrinology.com and like Salina Regional Health Center on Facebook. Follow us on Twitter and Instagram.